Well, I'm Dr. Hakim. I'm a neurologist, practice in Birmingham, Alabama for the last 25 years. We do treatment for people who have back problem, non-surgically. Our center called American Spine Center, and that's really our specialty in treating disc herniation non-surgically. And the way we'll look at that is from comprehensive multidisciplinary approach. We use it into 4 points, we call it, the pillars that we use. First one is really understanding the patient's condition along with education. In that part, we like to know the cause of their problem, and that's very important because the patient, if they would have back problem or disc herniation, even if it's acute, it does not happen out of blue. There's like a lot of predisposing factors. So we like to look into that to see what brought them to have the disc herniation. And then we do a lot of education to the patient to let them know what is their pathology is, what's the disc-like look. We show them an MRI if they have one. We do a lot of explanation, a lot of education. We have a lot of tool about education. Then we put treatment plan for them based on their pathology, and we tell them why we are putting the treatment plan. Because we engage the patient tremendously, and that's very important. Because we tell them this is a partnership between, both of us to get you better. And when we get the patient on board, things go very well. So that's really we do extra time, spending more time with the patient on the first visit. And that's where the education come into play. Then we put our treatment plan, which consists of a rehab program, which is like a physical therapy. We have technology called IDD or decompression, which really dealing with patient who has the disc herniation and trying to retract the disc. We explain to them how the disc, it is hydrated through the blood vessels and comes through osmosis. There's no direct blood vessel to the nucleus. So we explain that to them and tell them how this technology works and why it's work and how we can retract the disc. And if they have what we call risk factors such as smoking, we explain to them why smoking affect that disc in the first place, why it does, get them to have disc herniation when they went down just to tie their shoelace. So they do sometimes minor job, minor work, and boom, you get a disc herniation. So we explain to them how did they wind up there and why they have to stop smoking. So we do not really tell them to stop smoking, And I really go an extra mile about smoking because I really feel that's a tremendous. I take their packet, I let them destroy their cigarette in their garbage can in the room. And I'm very famous for that. And literally, patients quit smoking then. And I tell them, put your hatred in it and say you got me this. And so really get that emotional involvement with them. And of course I give them aid, Chantix, tell them how to quit smoking, other things. And that question, by the way, I always ask it every single visit. Did you quit smoking? Did you quit smoking? Did you quit smoking? So really, I engage them and I involve with them and I follow up on my recommendation. And when they quit smoking, I make it like a big thing. I tell all my staff, hey, this gentleman, this lady quit smoking. So I give them like a hallelujah, thing. So really give them that feel good. I'll tell them to tell everybody that they quit smoking because I'm trying to encarve it in their brain that they quit smoking because, that's easy to go back to it. So again, this is a simple technique what I do. Of course, I work with their weight. I make it very simple for them. So I like to lose 3 pounds a month. So it's really make it doable. They say, oh yeah, I can do that. I work on their sleep. That's very important. I treat their anxiety and depression. Very important because that's really part of that. And we do extensive blood work. We check really good panel. We find all kind of problem they have. Vitamin deficiency, B12 deficiency, iron deficiency, testosterone low, hemoglobin A1C is high. So we work all of that. That's part of our initial workup. So again, the treatment based on their pathology. Again, the decompression therapy is really very unique, and we tell them why it works. Again, how it really helps create a negative interdiscal pressure, bring you more fluid inside your disc, hydrate your disc, give it contractility of it, and help you really improve your condition. So that's really it, and we get them to involve with their exercise, do at-home exercise, and I tell them, like, you need to go to your private gym, and your private gym is really at home with your pajama on your carpet, and that's your private gym, and do it 5 minutes a day. So don't make it like go to the gym, to the Y. I said, that's fine, that's icing on the cake, but I want you to do 5 minutes at home in the morning and 5 minutes in the evening. The most important treatment that the patient might get easy to follow. You don't want to make it like 1 hour exercise. I would not do it. So I'll make it really doable for them. So really get them engaged, and I enforce the exercise every single visit. So that part of what's called the rehab program, the therapy, so engage them with. And the second thing is we do epidural block, facet block radiofrequency for people who have acute inflamed disc. Somebody acute disc herniation, definitely we need to get them to decrease the inflammatory aspect of this to improve their symptoms as well. That's part of the treatment. And I always explain to them, your treatment is really multidisciplinary. It's not a pill, it's not an exercise, not decompression, it's all of it. And when you do all of it, you get the best outcome. You're part of it, you get partial improvement. So that's patient, get them involved with this. So we do all this procedure for them. And the final part is, as I said, the wellness. When we do the big panel, then we'll find out what's going on. So we replace the vitamin D, their B12, enforcing smoking cessation, losing weight, exercising, enhancing sleep, treat their depression. Especially in this country, I am disabled. I said, no, you are an able person with back pain. Your brain is working, your arm is working, so use them. So I always push them to volunteer. Go to the school, to church, to nursing home, library. They, twice a week, engage them with people because they're really sitting in the corner, feeling miserable, counting every little thing's happened to them, and that what they get them down the drain. And that's really part of the treatment, get them engaged in their life again. They see the light again, they get engaged with their family. So I tell them, okay, participate by volunteering. So this way, okay, nobody will hire me, fine, volunteer for free, So this is another way to keep pushing them. Did you volunteer? Did you do this? Did you do this? And the continuity of that, and that's really day in and day out, every time we see them, that we do. And I give them my 15 and a half happy rules.
I love that.
And I challenge them to say, like, you get $100 if really you kind of memorize that. I'd love to give them $100 because I feel good they do that, So I play with them, I really play with them, and I feel like, I'm for them. I'm working with them to get them better. And that's really where they get involved. Unfortunately, we are very cold doctor's way. Doctor's office is very cold because we're like, okay, here's your pill, here's your medication, okay, please do this exercise, and done. And I don't think we go very far with that in pain management. It's really, and I think we are failing healthcare because lack of engagement. And again, that's, I have passion for that. I enjoy it. I have fun with my patient. I make so fun of them. I make really them laugh and laugh and laugh. Here, all my office laughing all day long. And
which decreases pain.
Of course. and the funny thing is, patients will be like, you can have like a party here, And literally we do. The staff enjoyed it too. Right. So it's a very positive environment. The patient feel like, this is a team, this is a work. I get them involved with a psychologist to treat their anxiety and depression. My best prescription for anxiety or depression, tell the patient, bring blank paper, write all your feeling. And as much as you want, as deep you want, and after you finish it, burn it. Because really you need to let go. And a lot of time we cannot tell people how we deeply feel. But once you write it down, and you can deeply write it down, and you throw it away, then you feel like, whew, that's, if I can do it like 3 times a week, that's an outlet for them, So that's, I tell them sometimes if you want to send it to President Obama, so like, okay, this is one of your citizens, this is how they feel. So, but these are small things, really help, but the patient have to be engaged, because most of the treatment is done not in the clinic, a home, you know. So that's really, I feel, secret, and that's what we've done in Dubai. Really, we brought the whole model over there, and Dubai patient is really completely different as far as medication. You know, we have a hard time convincing the patient to take NSAID more than 4 weeks. Like, you need a little bit more. Should I take it longer? I took it a course. Okay, please take another course, you know. You know, it's so funny. And pain medication there is like really unheard of, you know. So, I mean, you know, we have to deal with this here, you know. I feel depression is so important here. And I tell the patient, I'm going to give you a happy pill, you know. Happy pill, what's happy pill? Oh, a happy pill make you happy, you know. And I give them antidepressant. And I push it really high. I push it to the max and add another agent until they really get out of that depression, you know. So all those important elements in treating people who have problem with back pain. You know, unfortunately, we look at back pain as back going to the leg, but that is like that part of the condition. Right. The whole thing is really a human. You have to look at it from top to bottom.
Right. Do you find that people that go through a lot of your you know, non-pill or just any of the interventions, do you find that their depression improves, like with the increased activity and, you know, the things you tell them to do at home? Do you find that they don't need as much of that antidepressant once they kind of get over that hump? And
you know, I mean, it's amazingly, and I can tell the patient who followed the other rule from not, right. Because the one who follow rule, they are so much in their brightness in their face, they are more engaged, they feel like I've never felt so good. Say, okay, let's cut this, and I like to get them off everything, you know. So they're willing to do, they work with me in cutting this. But the one who's depressed, they're holding on their pill. Right. You know, they feel like this is their life, you know. But they're one like this, so everything, you know. And yes, absolutely, the one who really get engaged and involved, they do so much better, and they're willing to work with you on cutting all so much. As a matter of fact, a lot of people will get them off, you know, completely off. And, you know, that is really what, you know, we took complex cases in our spine center. We do failed back syndrome, multiple surgery, fusions, not an easy cases, but definitely we get them a lot better. And, you know, when I see patient have issue, I can't treat them, I get excited. It's like, I can't help that patient, you know? I feel so good, like, I can help them, you know? And I feel good about that, you know, from the output, you know?
Yeah. You're willing to take on those challenges, it sounds like.
It is interesting, really is, because you feel like, you know, I mean, you know, you feel like, I can't help that person, you know, by X, Y, Z, you know? Right. And the patient feel that vibe from first visit.
And it's almost as if sometimes the biggest challenge is getting them to buy into this process so that they actually implement the things that you recommend.
Absolutely.
And if they won the $100 by memorizing all that, I bet you if you did a study that maybe the ones that won the $100, maybe there's more that actually are getting more benefit down the road.
Very true. And you know, I tell them, you know, if you get the $100 here, but if you practice this, you get $1,000, you get $1 million. Because really that's your health you're investing in it, right. You know. I'm usually make people who are smoker, like, so you've been smoking for, you know, 30 years, or you burn $1 million. You're like, what? I mean, calculate it, $1 million in cash, maybe $10 million in health. And they're like, wow, I never look at it that way. You know, you give them this wake-up call, like, you have to look at it from this perspective and stop burning your money, you know.
Right. You almost have to give them extreme examples
yes.
for it to finally click.
Yes, exactly right. You know, I mean, and you know, literally, I would say 70 to 80% of people quit smoking in my practice.
That's fantastic.
Yes,
results.
absolutely. I cannot tolerate this, but you know, I committed it, but I keep pushing that, you know.
That's so great. Well, I'm so appreciative that you gave the time just to give an idea of what you do, and just, I don't know, just like-minded people that really want to make a difference and take on these challenges, and not dismiss the general public as if they're not capable of change, but really trying to bring them in and get them to buy into the idea, because I think that's the biggest stopping point for most people, is they just haven't gotten them to buy into the idea of this multidisciplinary approach right. and the self-care aspect.
Correct.
So I applaud you and all you're doing.
Well, thank you. Appreciate you. I'm glad you are thinking along the same wavelength, you know. Yes. I really appreciate that.
Yes, and it's great to come to conferences, because I think that's where the best part of networking is, that you do find like-minded people.
True, so, absolutely.
And I'm glad you spoke up during one of the sessions, because that's how I found you. So, so thank you very much.
No, thank you.